I'll read the task. Okay. Uh,
Hmm.
Patient name is Millie, who is 9 years old, has complaints of central abdomen pain for last 4 months. She
Mm-hmm.
has been seen by GP for quite a few times. She has a brother who has a constipation, and there are no major concerns with the Millie. So GP has referred for further evaluation. Okay.
Okay.
So you can modify as you want, no problem.
Yeah.
So she is 9 years old. Okay, mother and Millie. Okay. So I'll
Mother
start
name.
now.
Mother name is
Mother name is. I will ask.
Angela. Okay, fine, no problem.
I'll ask. Dr. Jayaprakash, you keep the time. Okay.
Okay. Time distribution 9 minutes and this
9 plus 5, 14 plus 19 and 23. 24. 23.
Yeah,
20.
9 plus 5 plus 9.
Hmm. Hello, good morning.
Good morning.
I'm Dr. Sandeep, one of the candidates today. Am I talking to Millie and her mother?
Yes, yes, doctor. I am Millie's mother.
So, ma'am, how can I address you?
Yeah, you can call me Miss Angela.
Okay. How are you, Miss Angela?
Yes, I am fine, doctor. Actually, I am worried about Millie.
Yes, yes. Millie, how are you, Millie?
Yes, I am fine also, doctor. But
Okay,
I have some tummy pain.
okay, okay. So today I am here to inquire regarding your tummy pain in detail. I have the GP letter, but Miss Angela, it would be great if you can tell the Millie's problems in your own words in little bit detail. Meanwhile, I'll take some notes. Is that okay with you?
Yes, yes, that's fine, doctor. Actually, we came for this problem only.
Yes. So can you tell me what is Millie's problem at this moment?
Yeah, Millie has many of the time suffered from tummy pain. Sometime it just lasts for 30 minutes, sometimes 40 minutes. And again, it subsides with little medicine. And because of this pain, many of the time she dropped the school also.
Mhm.
I'm really worried. I don't know what is wrong with Millie's stomach.
Yes, Miss Angela, I can understand your concern. So can you tell me that since when this pain has started?
This has started since past last 4 months,
Okay.
and since last 2 months, frequency has been increased. It
Oh,
is occurring repeatedly.
okay. Can you tell me more little bit about this pain, where it starts actually?
Yes, it starts sometime after the food.
Mm.
Sometimes when she has to go to school at even morning, also she feels this pain.
Okay.
And many of the time, I gave her paracetamol syrup, and after
Okay.
that, it subsided.
So where is the location exactly?
Yeah, it is around this belly button.
Okay. Okay. And if you have to rate the pain on this pain scale, 0 being the no pain and 10 being the severe pain, most severe. So, how much rating you will give to this pain?
Yeah, it's around 3 to 4
Okay, okay,
over 10.
okay. Apart from food, you said the pain increases with the food. Any other increasing factor? Any particular situation like stress?
Uh, Yes, I noticed that sometimes when she's not in a good mood, or when sometimes she has some the things in house which she doesn't like, I feel the next day also she complains of the pain. But
Okay.
I'm not quite sure about whether is it due to the stress.
Okay. So how long does this pain last usually?
Yeah, like 30 minutes, sometime even 1 hour also.
Okay. Okay. And as you said, it relieves with paracetamol, right?
Yes.
Okay. Is this pain is associated with any other bowel complaint like vomiting or diarrhea?
No,
Okay. Is there any constipation like her bowel habits?
no, so far no constipation.
Okay. So how is her bowel habit? Like is it regular?
Bowel habits, yes, regular.
Okay. Okay. Is this pain has any time you notice that this pain awaken the child uh, from the sleep in the night?
No, I have not noticed such thing.
Okay. Okay. Is there any blood in the poop?
No,
Okay. Okay. And any fever associated with this pain anytime?
no, so far it's not. She had a fever 4 months ago, but that was
Okay.
a viral fever, and
Mm-hmm.
she had just some cold and cough, but otherwise, no.
Okay. Does this pain occur every day or some days of the week?
No, it does not occur every day. It
Okay.
happens casually, like sometimes twice in a week,
Okay.
sometimes
Okay.
thrice in a week.
Mm-hmm. Millie, do you have any problem with your pee, like any burning or increased frequency?
Um, no.
Okay. Okay. So, how is her appetite, Miss Angela?
Yeah, she's eating well.
Okay.
Appetite is
Okay.
good.
So, no concern regarding the diet?
No, no.
Any particular food you notice that after that particular food that pain gets worse?
Mm, no.
Okay. Has there been any weight loss since the pain has started?
No, there I did not notice any weight loss.
Okay. Okay.
Her weight is good.
Okay. Okay. Have you to whom you consulted after for this pain apart from GP?
We
Any other specialist
consulted
you
GP.
consulted?
Yeah, we consulted GP, and also we consulted child doctor. They
Oh.
said it is normal and it
Mm-hmm.
will go with the time.
Mm-hmm.
But I'm worried, doctor. I don't think it is normal.
Okay. Okay. Okay.
Maybe she might have a
Mm-hmm.
pain because of probably she might start menses.
Mm-hmm.
I'm not sure,
Okay.
but it's
Okay.
kind of real pain, and she
Mm-hmm.
really
Mm-hmm. Mm-hmm.
sometime even drop the
Mm-hmm.
school also
Mm-hmm.
for because of that.
Okay. Mm-hmm. So is she missing the school because of this pain?
Yes, yes, many of the time she missed the school. She could not go to school because of this
Approximately
problem.
how many days she missed in last 4 months? Approximately.
Oh, last 4 months approximately, at least 10 to 15 days.
Okay. 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 So, what medicine you received for this till now, apart from paracetamol?
Yeah, one time the child doctor gave Gaviscon,
Okay.
and one time GP doctor gave paracetamol.
Okay. Okay. Is she still taking the medications?
Yes, yes. She takes
Okay.
whenever there is a pain. She
Mhm.
received paracetamol.
Okay. Had she been admitted in the past for any other reasons or because of this pain?
Yeah, in the past, she was admitted because she had one appendicectomy surgery was done on her,
At the
which
first.
was long 5 years ago.
Okay. Okay. And everything was fine after that?
Yeah, yeah, everything was fine.
Okay. Okay. So, is she having any joint pain after the since this pain has started or any time before?
No joint pain, doctor.
Okay. Any skin rash?
No,
Any problem with the eye or any mouth ulcer you noticed?
no.
Okay. Okay. So, I would like to ask little bit regarding the family. Is there anybody in the family in your family or near relatives is suffering from any uh, tummy problem, long-standing tummy problem?
Yes, yes, doctor.
Mm-hmm.
My grandmother had irritable bowel disease, irritable bowel syndrome.
Okay.
She used to suffer alternative constipation and loose motion.
Okay. Okay. And is there everything all right between you and your partner? Any stress in the family?
So far, no problem. Only Millie's father, he has a business in other
Mm-hmm.
country. So he's on the business tour since past 4 months.
Okay. Okay. And
So sometimes we miss him.
okay. Okay. How many kids you have?
I have other son who is a 6-year-old.
Okay. Okay. And do you
Fast.
have? Does he have any issues?
No, he's fine.
Okay. Okay. And any sibling rivalry you feel between these two kids, brother and sister?
Yeah, they fight sometime, and
Okay.
you know they
Mm-hmm.
hit each other also sometime. But at the end of the day, they are okay. Again, they play
Mm-hmm.
together,
Mm-hmm.
but
Okay.
no major issue.
Yeah. Yeah. That's nice to know. Do you work, Mrs. Angela? Miss Angela?
No, I am at home
Okay. Okay.
taking care of my children.
Okay. So, how this pain has affected your family?
Uh, Yeah, it has raised a concern because because of that, Millie is not able to go to school. Many
Okay.
times she drops school. Then the homework is also she's not able to complete.
Mm-hmm.
And recently, I noticed that she's lagging behind in her score also compared to before.
Okay. Mm-hmm. Okay. Do you feel that Millie is undergoing some depression or severe stress because of this pain?
Yes, I don't know. I'm not sure, but
Okay.
maybe she's not feeling happy because she was very good before.
Okay. 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 Any financial issues in the family?
No.
Okay. Okay. So, have Millie received all her immunization jabs on time?
Yes, yes.
Okay. Does she have any allergy to any particular food or any other allergies, drug allergy, anything like that?
No.
Okay. Okay. So, is she on any other medication apart from Gaviscon and paracetamol?
No, doctor.
Okay. Can you tell me a little bit about her birth? Anything, any concern at the time of birth?
Uh, she was born by cesarean,
Hmm.
and we had given discharge after 2 days. She was all right. There was no concern.
Okay. Any concern you have regarding her development, like she grown like her peers?
No.
No concern regarding her
Why,
development.
doctor? Is there anything worrying about her growth also?
No, as such, just we want to take all the details. So I'm asking regarding her development also.
Okay.
Okay, okay. Is there anybody in the family have migraine?
Yes, yes, doctor. I have a migraine.
Okay,
Sometimes I have a very severe bad headache.
okay. One thing I forgot to ask regarding the pain. How is her behavior during the pain? Do you feel she appears very pale and she complains of this photo like not able to look at the lights and like that?
No, no. She just feels uncomfortable, and
Okay,
she put her school bag and say, "Mama, I don't want to go to school because my tummy aches."
okay, okay. Uh,
14 minutes.
14 minutes. You did not tell at 9 minutes.
So I told, but in between
He
you
told.
keep on talking. I told
Okay, okay,
9 minutes.
okay.
Mhm.
So, so I'll take little bit. So I'll present my case. Okay.
Okay, okay.
So today I have taken history for 9-year-old Millie, from Millie and her mother. She presently she has a pain which is which has started 4 months back, and it is intermittent or approximately twice a week. The pain lasts for around 30 to 40 minutes, and it's mild to moderate grade. And this pain the uh, relieves with the paracetamol, and mother noticed that it sometimes get aggravated with the food. There are no other red flags associated with this pain. This pain probably it's aggravated related to stress related issues. uh, she has not received any other medication apart from Gaviscon and paracetamol. uh, Regarding family history, her grandmother had suffered from irritable bowel syndrome, and mother has migraine. The main concern of mother is that child has missed school for approximately 2 to 3 weeks, which is affecting her studies, and she's lagging behind the school. Uh, Regarding the past history, there is a she has undergone a surgery, appendectomy surgery 5 years back.
Okay. So, based on the history,
Mhm.
what is your differential diagnosis?
So, concerning the duration of the pain and the associations, my first differential diagnosis will be functional abdominal pain, as the pain is typically around the belly button and it is related to some stressors. Also, I would like to keep in mind like celiac disease, irritable bowel syndrome, and abdominal migraine.
Okay. Any strong pointers in the history which makes you to think other than the celiac and irritable bowel?
I did not get your question. Can you repeat?
Yeah. So, any strong pointers which
Mm-hmm.
makes you to think it could be possibly abdominal migraine or
Mm-hmm. Mm-hmm.
other than the celiac disease?
Yeah, actually, There is a family history of migraine. That is one of the important factor, and family history. Grandmother had irritable bowel syndrome. So this diagnosis, apart from functional abdominal pain, other diagnosis could have been considered.
Right, right. So if this child come to your clinic,
Mhm.
uh, what investigation you would like to do?
Okay. First, I would like to do complete physical examination. As the duration of the pain is long and there is quite a lot stress and anxiety regarding the pain, I would like to do some basic investigations like complete blood count, CRP, to rule out any infection or inflammatory conditions. Along with the ESR, I would like to do other investigation like urine examination, microscopy and culture, stool examination, microscopy and culture, liver function test, and celiac screen. I would like to do. Also, I would like to consider abdominal ultrasound. If this Because if ultrasound comes normal, then it will relieve the parental anxiety, and it will be easy for counseling that this is more of a functional abdominal pain and not an organic cause.
Mhm. So if I talk about this child only,
Mm-hmm.
then what you would like, based on your history, what specific investigation you would do for this child, not in general for a pain, but for this child only. Would you like to do all this test which you mentioned for this case?
Actually, if physical examination is normal, uh, ideally their
Let's
investigation
say
is
abdominal examination is normal. You did not
Mhm.
find anything
Okay.
in
Still, I
abdominal
would like to
examination.
do complete blood count, CRP, and abdominal ultrasound
And
and celiac screen.
okay, would you consider urine analysis?
There is no complaint as such, urinary complaint, so I might not consider doing urine examination. There is no
Okay,
fever history also.
okay, yes. Okay, fine.
Mhm.
So now, how you are going to manage, what you will advise to this mother?
Okay, management of functional abdominal pain. Actually, child requires regular follow-up. Most importantly, the non-pharmacological management, like family education regarding the nature of the pain, and reintegration of the child in the school that needs to be counseled. I would like to highlight the red flags in case the parent family notices any of these red flags, like blood in the stool, pain away from the belly button, or any concern regarding the weight loss, any vomiting or any diarrhea associated with the pain. They should come immediately apart from the regular follow-ups. Also, I would like to advise to maintain a symptom diary. So, any associations with the pain, like particular food or any particular situation which makes the pain worse, which could be analyzed on the follow-ups. Regular follow-up, I would like to monitor her growth, weight, height of the child, and take dietary history. Uh, Also, I would like to advise parents to give some analgesics like paracetamol whenever the pain becomes significant, and have a healthy lifestyle like have healthy food, drink a lot of water, do some exercise, engage mind in some useful activities. If along with that, sometimes the psychological review or psychologist help will sometimes can relieve the stress, identify certain factors, can into details of the family dynamics, and can identify certain
Right.
unidentified stressors which can help to which can help, and if the stressors are tackled, the pain may go away. These things can be done. and in follow up, if anything comes up,
And
then can be investigated accordingly.
time
Yes.
finished.
Okay.
Okay.
All
Thank
right.
you.
So, Dr. Sant, it was a good, very nice. Uh, First of all, introduction and exploring the main concern in detail analysis of the pain location site. Character, I think you forgot to ask the character of the
Mm-hmm.
pain. Radiation location you asked. That was nice. Severity, intensity also you ask. You also rule out the UTI. You also rule out the diarrhea, any gas kind of infection. I think you did not ask for gastritic burning type of. You did not rule out the gastritis, which was I
Mm-hmm.
feel
Mm-hmm.
um, need to
Okay.
be ruled out. Okay, and you
How
ask
to
about
ask
the
regarding
weight loss.
aesthetic?
You also like, do you have any burning kind of sensation in the
Okay.
chest
Mm-hmm.
or
Mm-hmm.
pain in the
Mm-hmm.
chest? Also, any vomiting or after the food you feel like
Okay.
vomiting and burning pain,
Okay. Mm-hmm.
which was not asked.
Okay.
And in the head, you came very late actually. Like in systemic review, you joint pain, rash, and all you asked, but headache you did not ask. When like
Mm-hmm.
in the last you came to the again with a migraine with it, that was good. Otherwise you could have missed that migraine and
Right.
headache. Headache also we need to ask here.
Right. Mm-hmm.
Then sibling, the family stressors, financial things you asked, but school you did not ask in more detail.
Okay.
um, like what happens, is there anything wrong in the school? And I mentioned to
Bullying
some extent like there is
actually.
a grading. Yeah, bullying could be one of the stressor in the
Bullying,
school,
exams, exam
which
stress.
yes, that you did
Mm-hmm.
not ask.
Mm-hmm.
And mother had a concern, probably the menses could be the reason for this pain. So regarding puberty also, you could have put
Ah.
forward one or two questions.
Mm-hmm.
uh,
Right.
yeah. And there is nothing much about the like heart and the chest,
So I
like any
purposefully
racing of
omitted
heart or any.
respiratory and cardiac. I purposefully omitted.
Mm-hmm. Okay, fine. But you, okay, then it is fine. So you remember, you were knowing, you were
Mm-hmm.
aware about this, and you,
Mm.
that's okay. That's fine. Okay,
So
1 minute.
any other?
Hello.
Uh-huh.
Yes, sister. Sandeep, just a minute.
Yes, yes.
So other people, you continue feedback just till I finish the one talk
Dr.
and
J,
ask
Dr.
you.
Maila.
Yeah. Hello.
Yes.
Yeah. I think Dr. Sandeep doing well, but there is some missing point.
Mm-hmm.
Like you can put in your differential diagnosis that this abdominal pain could due to constipation, functional abdominal pain. It's a celiac part of celiac disease. So you have to just go in hurry on each part in systemic review. Like if there is any change in her behavior lastly or recently, sorry, okay, any change in the bowel habits. Don't ask if there is constipation or diarrhea.
Mm-hmm.
Ask
Okay.
her if is there any change in the bowel habits, okay, any increase in the tummy size,
Mm-hmm.
okay, could be tumor, okay, we don't know, any increase in body size, any change in the skin color, whatever, the skin rash, pigmentation, whatever, okay.
Right. Very good.
Then yeah, then the activity, her activity, in any change, obvious change in the activity, if
Mm-hmm.
she is sleepy, okay, cannot doing her activities that previously do, okay. uh, and after systemic review, okay, you have to exclude also if there is any uh, preference of the weather. I mean, if she prefer the cold weather or the hot weather, to exclude if there is any hypothyroidism, okay. After that, okay, you have to follow the systemic review after the past history. You have to follow it by pubertal history. Puberty, it's most important here because she's in the age, I think, of the puberty, because the mother just mentioned that she's worried if she will start her menses or not. So you have to ask about that. If she starts her period, any change of the breast size, okay.
Yes.
So after that, you have to, if she's in a pubertal period and she started her puberty, you have to ask about any recreational drug, alcohol, sexual relation, or she has a boyfriend, she's on a contraception, okay, maybe she's pregnant if she has a sexual relation, okay. uh, then the development, the part of development, when the mother asked the candidate, why you ask about her development, I think you have to just tell her we want to rule out any cause of this pain, so we have to go through everything
Okay.
related to her,
Yeah, good point.
right?
Yes.
Okay. So the school achievement here is most important. For the school, we usually ask about school attendance, school achievement, any bullying or any problematic situation in the school. Maybe she doesn't want to go to school because she has a problem with a friend or she is facing bullying. Okay.
Mm-hmm.
So we have to ask about that. Okay. Uh, Dr. Sandeep asked about the impact of the disease on the family and the girl herself. Also, a social, sorry, a financial point of view. I heard from someone, a trainee in the UK. She told us before that if the condition is acute, okay, it
Mm-hmm.
doesn't matter if they have a financial problem or not. But if the patient have a chronic illness, you have to ask about that, because in that point or in this situation, you will need they will need daily allowance.
Right.
Okay, they
Right.
will give you yeah. Otherwise, they doesn't need. But you have to ask if they have insurance or not, whatever the condition is acute or chronic, they have insurance, they have rapid access to the any medical service, okay. This is the
Mm-hmm.
point that you have to ask about it, okay. Family history of same condition, family history of chronic illness, and he mentioned here migraine and irritable bowel disease, This is the most important here. Um, I think prenatal, postnatal, and natal, you can go through it. It doesn't matter here. Vaccination also. Here's the nutrition. Nutrition also important because sometimes iron deficiency anemia cause abdominal pain. Okay, so you have to ask about the nutrition. Can you please describe for me her meals? Okay, type. Okay, she described the meal also. Then she's taking any extra vitamins. Okay, this is the most important. And all the kids in the UK taking multivitamins even without any problem, just for supplementation. And the gross. Do you remember on which centile her weight, her height, or do you have her rebook with you? Okay. Do you feel that she lost an evidence weight during recently? And how that? If the mother said, yeah, I feel that she lost weight, how you can evidence that? From where you know that? From her clothes, like that. That's all.
Very good. You have raised very good points. You are quite expert in the history.
Yeah. Thank you.
So many points you discovered. Actually,
Right.
some of them asked weight loss. I think what I remember, he asked